Hello everyone and welcome back to MediInsights, where we unlock the wonders of wellness. Today we explain Benralizumab Injection, who may benefit from it, how it works, the expected benefits, common side effects, dosing schedules, and key safety tips to help you discuss this option confidently with your healthcare team. Let's talk about the conditions Benralizumab helps treat. Benralizumab injection is prescribed as an add-on maintenance therapy for people with severe eosinophilic asthma that remains uncontrolled despite optimized inhaled treatment. Doctors consider benralizumab when patients have frequent exacerbations and elevated blood eosinophil counts despite high-dose inhaled corticosteroids and long-acting bronchodilators. This medicine targets asthma driven by eosinophilic inflammation rather than other asthma types. Benralizumab aims to reduce exacerbation frequency, lower the need for repeated oral steroid courses, and improve daily symptom control and quality of life. Specialists perform careful assessment, including symptom history, lung function testing, adherence checks, and blood eosinophil measurement before recommending benralizumab. Benralizumab is not a rescue medication and does not relieve an acute asthma attack, so patients should always keep a quick relief inhaler ready. Some regulatory authorities also approve benralizumab for eosinophilic granulomatosis with polyangiitis in adults, a rare systemic eosinophil-driven disease. Treatment is typically started and supervised by a respiratory specialist or immunologist who monitors response and safety. Initial injections are often given in clinic by trained staff, and many services offer training for home administration when appropriate. Access may require specialist referral and funding approval, so practical considerations such as clinic access and cost are discussed when choosing this therapy. Let's cover the usual dosing and any timing tips. Benralizumab is given as a subcutaneous injection, delivered under the skin. The usual adult and adolescent dose is 30 mg per injection. Treatment typically starts with one injection every 4 weeks for the first 3 doses. After those initial doses, injections continue once every 8 weeks for maintenance. This dosing schedule helps establish rapid eosinophil reduction and then sustains benefit with less frequent visits. For eosinophilic granulomatosis with polyangiitis or special clinical situations, clinicians may follow different regimens based on guidance. Pediatric dosing varies by age and weight, and a specialist will determine the correct plan for children. Benralizumab is supplied as a single-dose pre-filled syringe or an auto-injector pen, and your healthcare team will demonstrate the chosen device. The first injections are often given in clinic, and some services train patients to self-inject at home when appropriate. If you miss a dose, contact your prescriber promptly to reschedule. Do not alter the dose or interval without medical advice. Store the medicine in a refrigerator and protect it from freezing and excessive heat, following storage instructions provided. Here's an easy explanation of benralizumab's action. Benralizumab is a monoclonal antibody that targets the alpha subunit of the interleukin-5 receptor on eosinophils. By binding to IL-5 receptor alpha, benralizumab specifically marks eosinophils for destruction. This antibody recruits natural killer cells which then kill eosinophils through antibody-dependent cellular cytotoxicity. The drug is engineered within a fucosylated Fc region, which enhances its ability to engage natural killer cells and trigger cell death. Because benralizumab reduces eosinophil numbers rapidly, inflammation driven by these cells in the airways decreases accordingly. Lower eosinophil counts result in reduced mucus production, less airway swelling, and fewer asthma exacerbations in patients with eosinophilic disease. This targeted mechanism differs from systemic corticosteroids that broadly suppress immune responses, offering a more focused approach with fewer systemic effects. Blood eosinophil measurements often fall soon after the first doses, reflecting the pharmacodynamic effect of the drug. Clinical improvements such as fewer attacks and better symptom control may develop over several weeks to months of consistent treatment. Unlike antibodies that neutralize interleukin-5 directly, benralizumab binds the receptor and induces direct cell removal, which is thought to produce a more complete depletion of eosinophils. Benralizumab can have side effects. Here are the common ones. Common adverse effects include injection site reactions, such as pain, redness, or swelling at the site of injection. Headache and sore throat have also been reported in clinical studies and routine use. Some people may experience fatigue, fever, or muscle aches after an injection, especially in the early treatment period. Serious allergic reactions, including anaphylaxis, have been reported rarely, so monitoring after injections is recommended, particularly with the first doses. Symptoms of a severe allergic reaction can include difficulty breathing, swelling of the face or throat, dizziness, and widespread rash. Because benralizumab reduces eosinophil counts significantly, there is a theoretical and observed concern about parasitic infections in endemic areas, and clinicians monitor for this risk. If a parasitic infection occurs and does not respond to usual therapy, physicians may pause benralizumab until the infection is treated. Always report new or worsening symptoms to your healthcare provider so they can assess the cause and decide if treatment should continue. Hypersensitivity reactions may present hours or even days after an injection, so stay alert for delayed symptoms. Discuss any history of allergic reactions to biologic medicines with your clinician before starting treatment. And finally, don't forget these safety tips and warnings. Always use benralizumab exactly as prescribed by your healthcare provider and follow the administration schedule. Do not stop or reduce other asthma medications without medical advice, especially oral corticosteroids, as reductions should be supervised. Keep your rescue inhaler available at all times, because benralizumab does not provide immediate relief for sudden asthma attacks. If you are trained to self-inject, follow instructions for preparation, injection technique, and safe disposal of needles and sharps. Store the medicine in the refrigerator and protect it from freezing and direct heat, following the storage guidelines provided by the clinic or pharmacy. Tell your doctor about all medicines you take, including inhalers, oral drugs, and any previous biologic treatments or allergic reactions. If you live in or travel to areas with high risk of parasitic infections, discuss this with your clinician, because reduced eosinophils can affect response to these infections. Attend regular follow-up appointments so your treatment response, symptoms, and any side effects can be monitored and managed. If you are pregnant, planning pregnancy, or breastfeeding, discuss potential risks and benefits with your specialist to make an informed choice. Ask your healthcare team what to expect in the first weeks and months of treatment and who to contact for urgent concerns. Thanks for watching MediInsights. Please subscribe and leave a comment with your questions or experiences, and talk to your healthcare team for personalized medical advice. Stay informed and safe while managing your asthma, and visit us for more medical guidance.